Assalamu alaikum. Hello, doctor. Today I will discuss in this lecture our algorithm for the hand pain. This is part of our QuadriSmart course, but this is a free lecture. So this is exactly how we are going to approach our cases in the course. There will be a case, you will see the scenario, and then I will discuss the algorithm, and then we will have one doctor who is practicing one case. Then we will have 10 cases as only to reach the diagnosis in 2 minutes. Then 2 minutes for every candidate, just he will follow the algorithm and catch the diagnosis. Then we will discuss the main cases that usually appears in the PACES exam and answer the questions of the examiner for investigations and for management plan. So this is exactly how we are approaching our cases, and we are preparing our lectures in our course. And again, our principle that it is not a matter of reading about the rheumatoid arthritis and about the osteoarthritis. It's a matter of how to catch in 2 minutes or 3 minutes your diagnosis, whatever what they are hiding in the exam. Recently, they prefer in station 5, they like to bring cases which is not direct, and sometimes you will have a patient without a finding. Okay, so you need to be familiar with the approach you are going to proceed through to reach the requested hidden diagnosis in station 5, which the exam consists from 5 stations, 172 marks. Station 5 only are 56 marks, which is about the third of the exam. Okay, so you will look now for this case, which is Mr. David Herman. He is 67 years old, and his problem is the complaining of hand pain, minimally responding to the over-the-counter painkillers with occasional fever. That's all. He will not say more than this, and you are expected to have 2 minutes and have another case there, and you need and you need to put your plan. So here, if you can memorize our algorithm, you will need to write nothing. You'll just memorize your algorithm and go inside and start to go through step by step, so you will reach the diagnosis. I'm not with writing some differential outside, because once you are inside and you found the answers are no, you will feel lost in the first 3 minutes and you may lose the station. So try to memorize the algorithm whenever possible, and this will help you to reach the diagnosis. So I will go now. I want every one of you to pick a piece of paper and write how he is going to approach this case, and then by the end of that you will stop the video, and then you will play the video again and follow me step by step in the algorithm of the hand pain, and then to catch the diagnosis according to the finding that I'm going to give you. So by the end of the algorithm, I will discuss exactly what was the finding in this patient, and you will find it is super easy to reach the hidden diagnosis that you didn't mention even in your differential. Okay, so now you can stop the video, write your notes, and then start it again after you are ready. Okay, now I will go through the algorithm, which is the hand pain. Okay, whenever I have hand pain outside, I will be prepared to start by OCD, 3S, PND. This is not only for the hand pain. This is doctors for all the joints pain that you can face in the PACES exam. So whenever I have joint pain or hand pain, remember to ask for onset, course, duration. Then you will ask about the 3 S's, okay, which is the swelling, symmetry, okay, and the stiffness. Then the PND is for the pain, and here you will ask about the severity of the pain, and you already asked and what increased the pain and what decreased it. You can use the Socrates. Then the N, okay, and this N is for the number of the affected joints, and this is important because you can know which joint affected, and this can help you in diagnosis. Then the D, which is the deformities, okay. Then the rash. So whenever you have any joint pain, remember to start by the OCD, then 3S, PND plus rash. Okay, remember that. Okay, then we will go to ask the next three main questions. The first question will be about the Raynaud's. Okay, you will ask about the color change on cold weather. So you can ask the patient, what do you mean exactly by the pain in your hand? Maybe he will say, okay, some description that help you to catch what is heading there. Okay, so when we will ask color change on cold weather, and if the answers are yes, so I'm talking about Raynaud's, but I am not done yet, because Raynaud's will be part of all other diagnoses I will have in the next coming minutes. Then I will go to the next question, which is, any electrical like pain and numbness decreased by shaking of the hands and cold water? You will ask this question and you will see if the answers are yes. If the answer is yes, so you would expect the carpal tunnel syndrome. And again, this is not the final diagnosis. You still need to dig deeper to find what's the association they are hiding in the case. Then you will go to the third question, which is the most important today, which is about the stiffness and the laxity. So you will ask, sir, do you have any stiffness or laxity? And remember, if you didn't ask the laxity, you will miss a very tough part of your case if it is joint pain related to laxity disorder. Okay, then the next question will be, does it increase by rest or decrease by effort? Actually, you can ask it that way, which is not the best way. My opinion, I can ask it, does it increase throughout the day or it is improving throughout the day? So if you said it's improving while I start working, so this is going with the inflammatory. If said yes, once I start working, my knee pain, my hand pain become worse and worse. So this is going with more with the mechanical. Okay? So this is the way you will ask this question. Then, if you found the answers are laxity, it is totally different. You are going to the right side. You are going to, there is 6 diagnoses, but the common to come in the exam are 3. Not that much common, but I know many doctors that have, especially who had the exam in UK, they got the Ehlers-Danlos syndrome. The Ehlers-Danlos syndrome is coming, it came before in UK, and there is one hospital, Whipps Cross Hospital, they had some girl working there, and she had this syndrome, and they like to bring her in the exam. Again, they can bring here and change the diagnosis to pseudoxanthoma elasticum. Okay, there is also the Marfan syndrome. So whenever I have these 3, I'll proceed like these diseases, and in our course we will discuss every case of this. So once you are here, you go through this, and then you go to laxity, then you have Ehlers-Danlos. So you need to ask the question and the things that confirm your diagnosis, and you will advise the patient regarding the Ehlers-Danlos, and you are done, and you got the 28 marks. Okay, if you found it is Marfan's, you will go through our steps that I will teach you about the Marfan's and how to ask and what are the risks, and then what's the advice to the patient, and then you will be asked 2 questions from the examiner and you will get the 28 marks. Okay, this is considered a hard, difficult case, but when you follow the algorithm, it will be super easy for you. Okay, then I found there is a stiffness. Okay, so if there is no stiffness, I'm talking about mechanical. I mean, the pain is getting worse through the day and there is no stiffness, this will increase the possibility of the mechanical. Okay, then if I found that there is a stiffness, okay, I need to know more about this stiffness. So once it is a stiffness, and this pain improving with some actions, and this stiffness is more in the morning, so I am talking about inflammatory cause of hand pain. Okay, so what do I need to know about the stiffness? I need to know its duration. Is it more than 1 hour or is it less than 1 hour? And remember, the examiners will tell the patient or the surrogate to answer the question in the way that's helping you. So when you ask him, not all the patients know how long the stiffness persists there or improving after how much time, but usually they will give you the answer that you want to know. He may say it's extend for 2 or 3 hours. He may say, no doctor, it's only 30 minutes. So whenever it is more than 1 hour, so this will increase the possibility of the seropositive. When it is less than 1 hour, this will increase the possibility of the seronegative, and we will go through that. Okay. What about if there is no stiffness and the pain increasing during the day? Here I am talking about the mechanical. What should I know about the mechanical? In the mechanical, you will have a circle of three diseases. One of them is osteoarthritis. The other one is the gout with its 6 questions, and the pseudo-gout with its 6 questions. And the 6 questions here, I mean the questions of the hypercalcemia, because there is possibilities of hypercalcemia causing the pseudo-gout and causing the joints pain, and you should exclude all of these. Actually, don't misunderstand what I'm saying. I don't say you need to ask all these things. I mean, you will go here, you will go through this side, you found that the patient is going with mechanical, so you are going here and hop, you ask the 6 questions of the gout, and you found that this patient he is on diuretics. Okay, this patient has psoriasis, so there is 6 questions you need to know by heart for the gout, and nothing outside these 6 questions will be hidden in the PACES exam. So this case will not be easy for many candidates, but for you, once you found this scenario, you will just pick it, you will catch it, the examiner will be very impressed, and you will get the full mark. That's why we are following the unique algorithm way in station 5. For the pseudo-gout as well, there is 6 questions. I will go back to them. Okay? Then, what is the other side? For the stiffness, now I know that it could be inflammatory, seropositive, and it could be seronegative. And again, to memorize these circles, remember that the seropositive, I make it red. Remember that the red line is the positive in the battery of your car. Okay, so the seropositive is the positive side of the battery, is the red. Remember the red circle. So in my lectures, when I say we will use the red lecture, you know what I mean. When we use the blue circle, you know what I mean, because this, when I'm going in the course to discuss all the rheumatological case in one day, I need you, once you start the 5 hours lectures in our course, by the end of 2 hours, you will know exactly what is the abbreviation we are using in order to pass fast and to check most of the cases that you should be aware of before attending your PACES exam. So here, what I mean by the right circle, the seropositive, I will ask about screening question about every one of these, but I want all of you to add a line here and put Sjogren syndrome. I didn't put the Sjogren. Okay, so for rheumatoid arthritis, you will ask about which joint affected. You will find that the small joint hands are affected, symmetrical, and you will get this answer early. Don't keep repeating the questions. If you get this answer early, no need to ask again, but you need to ask is that the small joints of the hands are affected. Does it affect the tips of your finger? Because as you know, rheumatoid arthritis are sparing, okay, the DIP, the distal interphalangeal joint, okay? So you will ask this question for rheumatoid arthritis, and you will ask as well about the symmetrical pattern of the involvement. You will ask about the deformity. You can ask about arm lumps and bumps. You can ask about any extra articular manifestation. You can just ask by any shortness of breath, awareness of heartbeat. Okay, so just like a screening, then you will go to the systemic lupus. Okay, for the systemic lupus, you will ask again screening question, and you need to practice that. You need just to show the examiner that you are asking about this. Don't ask general questions. So for systemic lupus, you will ask about, do you have any rash in area exposed to the sun? Do you have any mouth sores? Do you have any frothy urine? Okay. Then you will go and ask about the systemic sclerosis. Okay, and again, the screening question will be 2 questions: any tightness of your skin, in difficulty in swallowing. Then you will ask about dermatomyositis and polymyositis, and here you will ask about any tenderness of the muscle on touching the muscles. Then you will ask about the antiphospholipid syndrome, and you will ask here about the recurrent miscarriage, and you will ask about any history of recurrent blood clotting. And as I told you, you need to add the Sjogren syndrome, and you'll ask about dry eye and dry mouth. Okay, why you need to ask about these together? Because again, I said that before in my lectures. Sometime you will get the diagnosis of systemic lupus and you say, okay, I'm done. And when you get your mark, you will find that you only take 12 or take 15. Because in the top of the examiner sheet, the diagnosis is written there, and it will be mixed connective tissue disease. And so you didn't get the diagnosis, you didn't give the patient an accurate answer for his question about his diagnosis, and you didn't mention the right management plan and the right investigation. Because whenever you found mixed connective tissue, you need to ask anti-RNP. Okay, so here remember that mixed connective tissue disease, including the systemic lupus and systemic sclerosis and dermatomyositis, 2 of them or 3 of them, and rheumatoid arthritis can be there as well. Okay, and again remember that Raynaud's phenomena is part of all of these, so you can find the Raynaud's with any of these. Okay, which is the secondary Raynaud's. Okay, when it is secondary Raynaud's, it can be associated with any of these, so you can't stop here when you found it is Raynaud's. Okay, so now I asked about these. I want you to add something. What if you found this systemic lupus, okay, with male patient? I want you to add this. It's male patient. And as you know, systemic lupus and rheumatoid arthritis are disease of females. It is 9 to 1. You may spend all your life and you never see a patient, male patient with rheumatoid arthritis, or a female patient with systemic lupus. You may never see in your life. Okay, but it's still possible. But what if I found that this patient is male and he has the rash, okay, and this rash in his face, and you didn't find that much other symptoms of the systemic lupus, like kidney affection? So you will think about something else. You will think about what's called drug-induced lupus erythematosis. Okay, sorry. So here with systemic lupus, remember to ask about drug-induced, okay, lupus erythematosis. Okay. So this is the positive, the seropositive part, the red circle. Now I will go to the blue circle. For the blue circle, this is the negative. And ankylosis is not common to be associated with the hand pain. It's just part of the circle. That's why I'm adding this with the circle. But sometime the psoriasis coming in ankylosis picture, and you will find mix. You will find the back pain and you will find the hand pain as well. Okay, so you need to ask in the seronegative about any other back pain. You need to ask about the psoriasis, how, 2 screening question, nail changes and the nature of the rash. He will say the rash present there, scaly, itchy, presence behind the ear, presence on the beginning of the scalp. Then you will ask about the basic disease. You will ask about sores in the mouth, sores of the private area, recurrent blood clot. Reactive arthritis, patient can't see, can't climb the tree. So you will ask about the eye problem, you will ask about urination problem, you will ask about the joint problem, other joints, you will ask about recent infection. It could be GI infection, it could be a respiratory infection, whatever, and the patient will mention that the symptoms start after this infection. It could be since 1 year, sometimes it extends to 1 year and more. Then enteropathic arthritis, and the patient may have a history of celiac disease, the patient may have a history of ulcerative colitis or Crohn's, inflammatory bowel, So you will ask about chronic diarrhea, you will ask about tummy pain, you will ask about abdominal surgeries for Crohn's. Okay, so again you will feel, oh my god, I will ask all these when I have a hand pain. No sir, you will go through these: hand pain, OCD, 3SP, rash. Then I will go laxity, here I'm here, and I will continue as we will discuss in the separate cases. And when I have stiffness, I will go here and ask about the stiffness and ask the red circle and the blue circle. Whenever I catch a systemic lupus, I will confirm, is it systemic lupus or is it DEL, which is drug induced? Okay, the dial. If I found it is dial, I will go ahead and proceed. Systemic lupus, I will proceed. Whenever I found one of these is positive, I will never stop. I will continue to exclude the mixed connective tissue. Then I will go through the normal station, asking about drug history, past history, family history, and then this will take 1 minute. Social history, and then what's your concern, sir? You will answer his concern. You will get the 28 marks. Okay, that's what I want to teach you in my course. I want you know exactly how to approach everything. Okay, how to start everything. I want you to hide this and try with your colleague. Hide this and try with your colleague and search. Pick a very difficult one and let him go through the algorithm, and believe me, he will catch what you are hiding in your brain. And when you are confident in all the diagnosis that way, go ahead and attend your PACES exam and don't worry about station 5 or history station, because history will be the same. They like to hide reactive arthritis, and you will just impress the examiners when you reach the diagnosis in the first 2 minutes, and you still have 12 minutes in your history station. Then I will go here back to the first question. What if I found that there is Raynaud's? I want you to memorize that Raynaud's, okay, could be primary or secondary. For the secondary, you need to remember, for all the courses, you need to remember Raynaud's mean the hand is cold and painful with changing in the color. So you remember cold hand. The mnemonic will be cold hand. And as usual in my lectures, when you found this yellow lines, this means that this is the most common in the exam and the most important. So here, the cold is cryoglobulinemia, and how to ask about it? Cryoglobulinemia associated with itching, associated with rash on the shin of the legs, and it's associated mainly with hepatitis C virus. So you need to ask about any liver problem. You can ask about any yellowish discoloration of the sclera, any swelling of the leg, any tummy swelling or tummy pain. But you will not start asking by this. You will start asking by this. You will ask about the other joints pain. You will exclude our red circle. So whenever you have the Raynaud's positive, you will start by this one. You can put numbers if you want on your paper. So you can add here 1 for the, I will ask about this, the red circle, all the red circle, okay? Then you will go to the occupational, which is very common to come in the exam. The patient is working as a barber and he's using vibrating tools. The patient is working in a cold water. He's working as a fisherman, or he is working in shop that he's working, putting his hand on cold water all the time. Patient with trimming, all the trimmers. Then the drugs. And here by the drugs I mean BB and EE. BB here I mean beta blockers, and bleomycin, the common for the exam, is beta blocker. And EE is ergot and derivatives and estrogen, and the common is the estrogen, the ergot. Okay, so you'll find the patient on migraine and taking ergot, and hypertensive and taking beta blocker or whatever, or arrhythmia and he's taking beta blocker for that, or AF. Then for the H, you will ask about the hypothyroidism, and it's important as well. It comes in the exam. They can bring hypothyroidism with Raynaud's only. So hypothyroidism can be here and can be here. Could be a cause of Raynaud's, carpal tunnel syndrome. Okay, so remember it is in both of them. Then H for hematological. The H for hypothyroidism and hematological, I mean here lymphoma can be a cause of Raynaud's disease. Okay, and leukemias. The A for arterials, Berger's disease, and Berger's disease is associated with heavy smoking and gangrenes on the fingers. There is a constriction of the blood vessels on the tips of the finger and toes, and the patient may have gangrenes. Then the N for not known, which is a primary Raynaud's, just the Raynaud's and nothing else. Then the D for diabetes. So again, don't say that I only know I know the differential. It will not be that way. Again, you will go through hand pain, you will ask this question, and then you will ask this question. You will find it's positive. The examiner expecting you to spend the time asking. So once you found it's Raynaud's, you remember my lecture, you remember my algorithm, you will jump to this red circle, you will ask the questions of the red circles, okay? And then you will go and catch one of these diagnoses or the mixed connective tissue and whatever, and you'll proceed. You may find this Raynaud's only occupational, and your advice will be regarding his job and changing the job and helping him in that, and you'll get the 28 marks. Okay? So whenever you're going through these, I need you to have 28 marks. I will not accept any of you after this lecture to miss any marks in hand pain case. So for the second question, it will be about the electrical light pain and numbness, which is decreased by shaking the hand and cold water. So this is a carpal tunnel syndrome, and again our mnemonic is related because it is median trap. For median trap, I mean trapping of the median nerve. The M is myxedema, which is the hypothyroidism associated with carpal tunnel, as I told you, it's involved. The E for ethanol, the D for diabetes, all can cause carpal tunnel. And then idiopathic, then amyloidosis. How to ask about diabetes? You can, any history of diabetes, drinking, and how much. But again, the yellow are the more common in the exam. So there is idiopathic, there is amyloidosis, you will ask by pins and needles and frothy urine. Neuropathy, you will ask about the cause of neuropathy, the main causes. You ask it about alcohol and diabetes. So the only remaining vitamin B12 if the patient is a vegetarian and lead. Then the trap. The T is for 3T. One of them is very important, which is trimming. The patients with trimming, the barber patient, the jackhammers again. These people who have these vibration tools, they can get the carpal tunnel. Okay, because there is inflammation happen in their wrist, compressing the nerve. The tumors, some tumors can cause that, and trauma. Then for the R is rheumatoid arthritis, for the A acromegaly and pregnancy. So sometimes it's just hand pain and you found it's carpal tunnel and inside it's acromegaly. And as you will learn in our course how to approach the case of acromegaly in 6 minutes to finish everything requested in the for acromegaly. So it's like that. You will start, jump, ask this question, it's carpal tunnel, you will go through median trap, you will find it's acromegaly, or the patient have spot diagnosis, so you'll go to acromegaly and confirm your diagnosis, check for complication. That's exactly what you should do in station 5, and that's what we expect after our course to be ready to do with any general symptoms. Okay, you don't expect in the exam to go and found it is just a case of tightness of skin. They will never tell you there is a tightness of skin. They will not bring it that easy. There will be something hidden. Okay, so you ask it this question, you reach your diagnosis. I started by this side because this is the most common in the exam. Whenever you have these, you learn it now how to jump to these. I want you to practice with your colleagues. Just hide one of these, put it in your mind, let him go through the algorithm. Once he said yes, you are done, the game finished. Go to the, he will start, you will hide some diagnosis till whatever you will hide, he will catch. And once he catch, he will proceed as what any book say. Okay, because it will be very simple once you have the diagnosis what to proceed. Again, a lot of doctors asking me, we want to discuss the investigations of blood works. Okay, I will do that in the course with the individual cases, but I mean this is there in all the books. This is the problem. You don't know what to do outside. You are very lost inside. You are going in bizarre. So never what they are hiding, you can't find, you can't catch it. Okay, I need you to know this algorithm by heart. You will have a lecture tomorrow. You will get today. You will get a link, and I want you to be prepared in order to get the diagnosis. Tomorrow I want you today I want you just to stop the video, and once you read write your notes, try to reach the diagnosis, okay, and check if you are okay with that, because this will be our way in the course, the algorithm, and then 10 cases or 15 cases very fast, every case 2 minutes, so you will know how to catch everything if there is a hand pain in your exam. Okay, so now after that I will go to the gout questions. Okay, I know all of you want to know what we are asking in the gout. So you are expected here, just a second please. You are expected here to ask the 6 questions for the gout. You need to ask about psoriasis, because there's a very big association between psoriasis. So you will ask about skin rash and ask about the, I mean, you don't say that you already asked about psoriasis, because you will not go to this side. You will go through this line, so you didn't ask about psoriasis yet. So you will ask about skin rash and nail changes, and where is the site exactly of the skin rash, is it scaly, and you will examine it. Okay, then you will ask about any medication the patient taking because of diuretics. Okay, so you need to ask about the diuretics. Okay, then you will ask about the alcohol. The patients with high alcohol consumption expected to have the psoriasis. This is the third question. The fourth question, after the alcohol, they like to drink and eat. So you'll ask about his food. He's red meat eaters. He is this one who is eating burger every day, eating meals every day. So you need to ask about the nature of the food. You will ask about lymphoma, how? About weight loss, about night sweating, about lumps and bumps, any history of any tumor or something. So this is the lymphoma. And then the last question about the family history. Okay, the Lesch-Nyhan syndrome, which is associated with the gout. So you need to have this 6 question in your mind. Psoriasis, diuresis or diuretics, alcohol and food, lymphoma, and Lesch-Nyhan. Okay? Then we will go to the 6 questions I told you about the pseudo-gout, and I mean here the hypercalcemia as a cause of the pain. And again, any of these can be your case in the exam. Okay? So we will ask about the TB as a cause of hypercalcemia. So you will need to ask first about the symptoms, the hypercalcemia. So whenever you have this mechanical, you will ask about the hypercalcemia by asking about excessive thirst. Okay, about the tummy pain, about the mood disturbance, about the constipation. Okay, so remember to ask about the symptoms of hypercalcemia, the other symptoms other than the joints pain. Then you will go through asking about TB and sarcoidosis. How to ask about TB? Again, weight loss, night sweating, coughing out of blood. Okay, weight loss. Then I'll ask about sarcoidosis. I'll ask about the shortness of breath. I will ask about the rash in the front of the chin rash. Okay, I will ask about we said shortness of breath. I will ask about the other symptoms of hypopituitarism, and when we discuss the sarcoidosis, we'll have a case of sarcoidosis, so you know how to approach it, because they like when the sarcoidosis invades the adrenal glands and invades the pituitary gland, and it's common in UK exams. They like when they catch any sarcoidosis patient, they will bring with any different or any difficult diagnosis. Okay, then you need to ask about the hemochromatosis. And as you know, and this came in the previous diet, in the second diet in 2018. It was a case of hemochromatosis causing pseudo-gout. So it was mechanical pain, and this mechanical pain, he go through this, and he found it is hypercalcemia. Okay, and this patient when he dig deeper, try to exclude the hemochromatosis, because he know our algorithm. So he asked about darkness of skin. He had liver symptoms. They give him a clue about liver symptoms as well. And there is impotence. Okay. And I have one doctor asked me what is the association between the hemochromatosis and the hypercalcemia. There is a big association, because the deposition of the iron in the joints, okay, do 2 things for the calcium. It prevents the excretion of the calcium. It's like trapping the calcium crystals. It's trapping the calcium crystals, and at the same time it increases the formation of the crystals. So these 2 reasons cause the patient with hemochromatosis to have hypercalcemia, and that's why they advise him to have his diet low in iron and low in calcium. Okay, and you will need the parathyroid hormone as well. This is just a knowledge, not for PACES, just for your knowledge to remember that the parathyroid hormone itself become increased in hemochromatosis, although the calcium is high. So it looks like the primary hyperparathyroidism, but it is not. So you need to ask, just show the examiner that you are asking about the hemochromatosis. Again, sometimes they are hiding Min syndrome. Okay, and if you catch it Min syndrome in a case with knee pain, so you are a hero and you will get the 28 marks. Okay, because you will just go, he have joint pain, and you go and found it is mechanical, and it is knee pain, for example, hand pain, for example, and then you keep asking according to our algorithm, and you found symptoms hypercalcemia. You start to exclude the cause of hypercalcemia, and then you found the patient has headache and symptoms of acromegaly, or have prolactinoma, or he has phychromatosis. Okay, so you have hyperparathyroidism with Min syndrome. So you are done and you get a 28 marks. Other doctor will never be able to reach that difficult hidden diagnosis. Okay? So again, that's how they can play in the case of hand pain or joint pain, and I want you to be prepared, The last question here, you will ask for hypercalcemia, the thiazide diuretics. As you know, thiazide diuretics will increase the calcium as well. So the thiazide you need to ask by name. So here it is men, thiazide, hemochromatosis, sarcoidosis, and TB, and add the other cancers as a cause of hypercalcemia. So this is the sixth question for the pseudo gout and sixth question for the gout. And for the osteoarthritis, he will give you that he gained more weight, you will have crepitation or crepitus on his joints, and he will have sometimes some deformities as well. There is affection of the DIG, the distal interphalangeal joint. Okay, so by exclusion of others, you can say this is an osteoarthritis, and it is asymmetrical. Okay. So this is exactly, doctors, how we are approaching the hand pain. This is the way I am discussing for the doctor who didn't attend my lecture before. This is the way will be in our course. I will give the algorithm. I will give you all the possible cases, but we will not spend the full time. We'll just spend 2 minutes or 3 minutes in every case. Once you hit the diagnosis, I will go to the next and next and next, and then we'll have one full case to memorize you and need to remember the structure of the station 5. And then we will go to the knee pain, then we will go to the laxity or hyperextensible joints diseases. Then in one day you will know exactly what you will do with any rheumatological case. Okay, this was the case. You read the scenario in the beginning of our lecture, and for the doctors who attend our lecture yesterday, it was about this patient. When you dig deeper, you will find that this patient have a malar rash, and he has photosensitivities in the area exposed to the sun. But he is a male, and as we said, it is very difficult to find a male patient with systemic lupus. Okay, and again, why not? I will ask about his urinary kidney symptoms, and I found that his urine amount is normal, there is no change in the color, there is no frothy urine. Okay, and almost maybe there is no systemic manifestations. So I will review his drug chart or take his brief history, and I found that he has a past history. This patient has a past history of epilepsy, or fits. He was diagnosed since 3 years, and since 1 year since that time he started on phenytoin, and since 1 year he has this joint pain and fever, and he's not responding to the over-the-counter meds. Okay, that's why he came in the exam. This patient was in Maadi Hospital in the last diet. Okay, and it was not an easy case, but if you have this algorithm, it is super easy for you, because this is systemic lupus in male. So I will consider, and this case came only by hand pain. Okay, you will just expect that, as by the algorithm, it will be a drug-induced lupus erythematosus. Okay, then you will go and review his medications. You will advise him that we need to discuss this medication with your neurological doctor, with your nerve doctor. Okay, because we can't stop it immediately now, because the fits are a serious thing, and maybe he will need to change it to the drug that will not cause this side effect. Okay, and if he asked you, will it stop once I start the medicine, you will tell him we expect good improvement. Okay, but we can decide that now. We want to see first what will be the discussion with our team of the joint doctor and the nerve doctor. Okay, that's exactly. He will just ask you, what's your differential? The examiner will ask you, what's your differential? Will you stop his phenytoin? You will say, no, I can't stop it immediately now. I want to go back to the nerve doctor to change for a safe medication. Okay, then if he asks you what the investigation you are going to do, just don't waste the time in saying not important thing. Say I will do basic investigations and anti-nuclear antibody and anti-histone, okay, and anti-double strand DNA. So the examiner want to hear this to give you the full mark. Okay, don't waste the examiner's time. Okay, here I will give you some idea about that for the doctor who didn't attend my lecture yesterday. For systemic lupus, it is systemic, so you will expect more sorry, you will expect more systemic symptoms. For the dial, which is drug-induced lupus, okay, you will expect less and less systemic symptoms. So the age, you would not expect a newly diagnosed patient with systemic lupus in the age of 60, and it is 9-to-1 female to male, so you would not expect systemic lupus in male. But here for the drug-induced, it's 1-to-1. And then the systemic lupus will not start suddenly. For the dial will start suddenly. But remember, You don't exclude it because the patient started the medicine 3 years ago and the symptoms started 1 year ago. No, it can start after months, it can start after years, but it would not stop unless you stop the medication. But they shouldn't start together. Okay, remember, this point is very confusing for some doctors. Again, more systemic involvement here, less systemic involvement. For the Raynaud's, its affection is 50%, so less common to see Raynaud's with dial. Okay, again, all of you think that antihistone is very specific for the dial, drug induced, but it is not. The antihistone is 50% positive in systemic lupus, but actually it is more selective here, for it's 95% for the dial. Okay, and the anti-double strand you should mention, because the anti-double strand is positive in systemic lupus, but it is not, it is rare to be positive in dial. Okay, the anti-single strand is the positive in the dial. I think the examiner don't know these details because he will not be a rheumatologist, but at least you can say antihistone, anti-double strand DNA, and anti-nuclear antibody. And remember again, the complement, that's for you, for your patients in the real life. The complement here is decreased, but the complement here is normal. Okay, then you will go to the histopathology, and I don't care about that because they are the same and it is not part of the PACES. Okay, I want you to know what is the medication that can cause this drug-induced lupus. You will find this in yellow color, the brocanamide, hydralazine, penicillamine, methyl-duba, and they will not give it clearly. You will find the patient with heart problem, with heart rate problem, and you will check his medication. You will find brocanamide. Remember that he mean here with the joint pain that died. Okay, hydralazine for blood pressure, methyl-duba, okay, penicillamine. Here you will find this from up to date. There is definite, there is probable drug, there is possible. The definite is more. This medication will do it. Okay, brocanamide, hydralazine, minocycline, diltiazem, penicillamine, and isoniazide. So remember, isoniazide can come, you can make it in yellow as well with the others. And remember, this TNF, the anti-tumor necrotizing factor, is important. You know why? Because the patient can take this medication to treat any rheumatological disease. Maybe he is taking the infliximab for treatment of rheumatoid arthritis, and this caused the drug-induced lupus, and they will expect now it is a mixed connective tissue, but it is not. Once he stopped the infliximab, the symptom of the lupus went away. Again, this is for your real life, but you need to know that the biological meds like infliximab can cause drug-induced lupus. Again, this is the phenytoin, and this was the case in Al Maadi Hospital, and it can be repeated anywhere. Okay, they can just change the scenario to a patient with TB, and he started on isoniazide or rifampicin or whatever. Okay, again, the possible, there is less commonly to cause. You can just take a look for this. Okay, so this is the drug-induced lupus. Okay, that is what again, this is our bundles. We will discuss all the bundles in our course. Okay, you need to know the bundles, because once you catch the diagnosis, you will go through this structure. Okay, so you don't need to go through the bundles if you catch the diagnosis, but I mean you need to continue the present history and past history, the family history, drug history, and social history as well. Okay, then please join our group on Facebook. Okay, again, I want to tell you that, memorize you that if you want to attend our course, first day of the course will be a trial for the doctors who want to attend as trials. You should record your name with Dr. Mahmoud, because we need to know the numbers that will attend. The trial will be free. It will be 5 hours the first day of the course, but you will not be practicing the cases. The practicing will be for the doctors who already registered with us to complete course. For the doctors who will attend the trial in the first day, you will be a watcher, and you can spend the 5 hours learning the things that we will share. If you found that you are interested and there is a space still there, you can join us and continue the course with us. If you found that no spaces, you can just register for the next coming course. If you are not interested, you are very welcome just to spend some time with us. Okay, I hope you found that helpful. Thank you, doctor. Please leave a reviews, make a like. If you want to ask any question, please feel free to ask through our WhatsApp group. Contact Dr. Mahmoud to add you to the WhatsApp group or the Facebook. Contact Dr. Mahmoud for the course details. The price of the course is very reasonable, more than what do you think. And again, if any doctor has any problem in the financial issue on these things, okay, come back to us and don't worry about this point at all. We still are colleagues and we want to help rather than anything else. Thank you, doctors, and have a great day, and see you in the next lecture.